When you feel it's time to try and get off the peg, it is a lot tougher than you initially think. And the simple things aren't quite as simple. So even with starting with water and fluids can be quite difficult initially. The pain caused by the radiotherapy, which although it's very visible from the outside, when you lose the skin on the outside of your neck, a lot of people don't realise that the inside of your neck has been destroyed by the radiotherapy just as much as the outside. So taking anything down your neck is actually very painful. Through coming in, meeting your speech therapist and starting with just drops of water and making sure that your muscle is actually working properly, so it closes over to allow the water to go down the right hole basically, so it's not going back into your lungs. And with the therapist sort of watching you and just really taking an interest in making sure that you're doing it properly, and it is just a sip at a time initially. But I would also say that it's similar with the saliva glands afterwards. I don't think people realise just how important a part they actually play in your everyday life until you don't have them. And then you realise that your saliva glands are something that really are a very, very important part of your makeup. Without your saliva, a normal person would put food in their mouth and just take it for granted that they can chew it and swallow it. When you don't have any saliva glands, the food goes into your mouth okay, you have to chew it much harder, and your saliva isn't there to break it down. So you chew it as small as you can possibly get it, and then if you have a strong swallow, you can maybe get the food down without, if it's oily or if it's wet. If the food is dry, you have to drink water to get the food down your throat. So without a drink or without an oily food, your recovery can be very difficult.